Some of the most dangerous things for your kidneys may already be sitting in your medicine cabinet. Not illegal drugs, not rare hospital chemicals, not strange supplements from the internet. I am talking about common medications, the pain pill you take for your knees, the antibiotic you saved from last year, the heartburn pill you have been taking every morning for years, the water pill you take when your ankles swell, the blood pressure medicine you stopped because you felt fine, the antiviral you skipped because your symptoms improved, the mood stabilizer you take every day but do not monitor regularly. And here is what makes this so serious. Most medications do not feel dangerous when you take them. You swallow one pill, you feel better, the pain drops, the acid stops, the infection improves, the swelling goes down, the mood stabilizes, the blood pressure improves. So naturally, you think the medication is only helping. But your kidneys see the other side of the story. Your kidneys ask different questions. How much of this drug must be filtered? Does this drug reduce blood flow to the kidneys? Does it change sodium, potassium, or magnesium? Does it concentrate in the kidney tubules? Does it combine dangerously with another medication? Is this person dehydrated? Is this person over 50? Does this person already have diabetes, high blood pressure, heart disease, or chronic kidney disease? Because after 50, medication safety changes. Your kidneys may not have the same reserve they had at 30. Your body may clear drugs more slowly. You may be taking more than one medication. You may have more than one doctor. You may be using over-the-counter pills that your doctor does not even know about. And that is where the danger begins, not always from one pill, often from the combination. One painkiller, one water pill, one blood pressure medicine, one period of dehydration, one stomach virus, 1 week of poor appetite, one person who never checked kidney function. That is how kidney stress can happen quietly. I am Dr. Adrian, and today I am going to show you 7 common medication groups that can quietly damage, stress, or overload your kidneys if they are used the wrong way. But before we go further, listen carefully. Do not stop any prescribed medication because of this video. Do not change your dose because of this video. Do not skip antibiotics, blood pressure medicine, water pills, antivirals, lithium, heartburn medicine, or any prescription without speaking to your doctor or pharmacist. Stopping the wrong medication suddenly can be dangerous. This video is not about fear. It is about awareness. It is about knowing which medicines need caution. It is about knowing which questions to ask. It is about knowing when kidney tests are needed. It is about making sure the medicine that is helping one problem does not quietly create another. And stay with me until the end, because after medication number 1, I will give you the exact questions you should ask your doctor or pharmacist before taking any new pill. Those questions are simple, but they can protect your kidneys. Now let us begin with medication group number 7. Antibiotics. Antibiotics can save lives. Let me say that first. If you have pneumonia, a kidney infection, a serious skin infection, sepsis, or a confirmed bacterial infection, antibiotics can be essential. They can prevent an infection from spreading. They can stop bacteria from multiplying. They can keep a treatable infection from becoming dangerous. So antibiotics are not the enemy. Misuse is the enemy. The problem begins when antibiotics are used for the wrong reason, the wrong infection, the wrong dose, the wrong duration, or the wrong kidney function. Many people still believe antibiotics are needed for colds, flu, most coughs, and many sore throats. But antibiotics do not kill viruses. They work against bacteria. So if you take antibiotics for a viral illness, you may get side effects without benefit. You may disrupt your gut bacteria. You may increase antibiotic resistance. And in certain cases, especially with certain antibiotics, you may add unnecessary stress to your kidneys. Now, your kidneys help remove many antibiotics from your body. If your kidney function is reduced, some antibiotics may build up. And some antibiotics can be directly nephrotoxic, meaning they can harm kidney tissue, especially in high-risk patients. Certain antibiotics, like aminoglycosides, vancomycin, and polymyxins, are known for requiring careful kidney monitoring in many situations. These are not casual drugs. Sometimes they are necessary, sometimes they are exactly what a serious infection needs, but they require respect. They may require blood levels. They may require kidney tests. They may require dose adjustment. They may require careful hydration guidance. They may require hospital monitoring. Now here is the everyday mistake. A person gets antibiotics for an infection. They take half the course. They feel better. They stop. Then months later, they feel sick again and take the leftover pills. Or worse, they give those pills to a spouse, neighbor, or family member. That is dangerous. An antibiotic prescription is not a general-purpose tool. It is chosen based on the suspected infection, the bacteria, the site of infection, allergies, kidney function, age, other medications, pregnancy status, and local resistance patterns. What helped you last year may be wrong today. What helped you may be wrong for someone else. If your doctor prescribes an antibiotic, ask simple questions. Is this infection bacterial? Is this antibiotic necessary? Is it safe for my kidneys? Does the dose depend on my eGFR? Do I need blood work before or after taking it? Should I avoid any other medicines while taking it? Should I take it with food or on an empty stomach? What side effects should make me call you? And if you already have chronic kidney disease, diabetes, high blood pressure, heart failure, or you are older, make sure your doctor knows before starting antibiotics. Do not assume they already know. Say it clearly. I have kidney disease. My eGFR was low. I have diabetes. I take a water pill. I take blood pressure medication. I take lithium. I take NSAIDs. I take supplements. Those details matter. Now, warning signs while taking antibiotics include reduced urination, swelling, unusual fatigue, confusion, severe diarrhea, severe rash, persistent vomiting, or feeling dramatically worse after starting the medication. Do not ignore those signs. Antibiotics can be life-saving, but they must be used with precision, not fear. Precision. Medication group number 6 is NSAIDs. This is one of the biggest kidney warnings in everyday life. NSAIDs means non-steroidal anti-inflammatory drugs. You may know them as ibuprofen, naproxen, diclofenac, high-dose aspirin, Motrin, Advil, Aleve, and similar pain relievers. These medicines are common because they work. They can reduce pain. They can reduce inflammation. They can lower fever. They can help with headaches, back pain, knee pain, arthritis pain, muscle strains, dental pain, and injuries. But here's the danger. Because many NSAIDs are sold over the counter, people assume they are harmless. They are not harmless for everyone. Your kidneys depend on good blood flow. NSAIDs can reduce certain protective chemicals that help keep blood vessels open inside the kidneys, especially when the body is under stress. If you are healthy, hydrated, young, and using an NSAID occasionally, the risk may be lower, but after 50, the picture changes. You may have high blood pressure, you may have diabetes. You may have reduced kidney reserve. You may take a diuretic. You may take an ACE inhibitor or ARB. You may be dehydrated. You may be sick with fever, vomiting, or diarrhea. You may take NSAIDs for several days or weeks because the pain keeps returning. That is when risk can rise. Let me give you a real-life situation. A man has knee pain. He takes ibuprofen every morning. He also takes a water pill for swelling. He takes a blood pressure medicine ending in pril or sartan. Then he gets a stomach virus. He eats less, he drinks less, he has diarrhea, but his knee still hurts, so he keeps taking ibuprofen. Now his kidneys are facing several pressures at once. Less fluid, changed kidney blood flow, a diuretic, a blood pressure medicine, an NSAID. This is the kind of combination that can push a vulnerable kidney into acute injury. Doctors sometimes call the combination of an NSAID, a diuretic, and an ACE inhibitor or ARB the triple whammy, because together they can increase kidney injury risk in susceptible people. Now, do not panic if you have taken ibuprofen before. That is not the point. The point is to stop using NSAIDs casually, frequently, or blindly. If you need pain relief often, ask your doctor what is safest for your kidneys. Ask whether acetaminophen is safer for your situation. Ask whether physical therapy could help. Ask whether weight loss could reduce joint pain. Ask whether stretching, strengthening, heat, topical treatments, injections, or other strategies may reduce your need for pills. Ask whether your kidney function should be checked. If you already have chronic kidney disease, many kidney organizations advise avoiding NSAIDs unless your clinician specifically says otherwise. And be careful with cold and flu medications. Some contain NSAIDs. You may think you are taking something for congestion, but it may include a pain reliever that affects the kidneys. Read labels. Do not combine ibuprofen and naproxen. Do not take extra doses because the pain is stubborn. Do not take NSAIDs before heavy exercise and heat. Do not take them when dehydrated unless your doctor has told you it is safe. Warning signs include swelling, sudden weight gain, reduced urination, shortness of breath, high blood pressure, severe fatigue, nausea, or feeling unusually weak. NSAIDs can help pain, but they can also quietly stress kidneys. Use them with respect. Medication group number 5 is diuretics. Many people call them water pills. Common examples include furosemide, hydrochlorothiazide, bumetanide, torsemide, spironolactone, and others. These medications help the body remove extra salt and fluid through urine. They can be extremely important. For someone with heart failure, a diuretic may help them breathe. For someone with swelling, it may reduce fluid buildup. For someone with high blood pressure, it may help control pressure. For someone with liver disease or certain kidney-related fluid problems, it may be part of a life-saving plan. So diuretics are not bad, but they are powerful, and powerful medicines require monitoring. The kidney risk with diuretics usually comes from fluid and electrolyte imbalance. If the dose is too high, if you lose too much fluid, if you become dehydrated, if you are vomiting, if you have diarrhea, if you are sweating heavily, or if you combine diuretics with other kidney-affecting drugs, kidney blood flow can drop. When the kidneys do not receive enough blood flow, filtration can worsen. Electrolytes can also become abnormal. Sodium can drop too low. Potassium can drop too low or rise too high, depending on the type of diuretic and the person's health. Magnesium can change. Blood pressure can fall too low. Or if you stop the diuretic wrongly, fluid can build up and breathing can worsen. This is why diuretics require balance. Too much can dehydrate, too little can allow fluid overload. Now here is the common mistake. A person sees ankle swelling and thinks, I will just take an extra water pill. Or they feel they are urinating too much and stop the pill without telling their doctor. Both can be dangerous. If you take a diuretic, ask your doctor what you should do if your weight changes. Ask whether you should weigh yourself daily. Ask what weight gain means. Ask what weight loss means. Ask what to do if you have vomiting, diarrhea, fever, or poor intake. Ask how often electrolytes and kidney function should be checked. Ask whether NSAIDs are safe for you. Ask whether potassium supplements or salt substitutes are safe. This matters especially for spironolactone and similar medications because potassium can rise in some people. If potassium becomes too high, it can affect the heart. Warning signs of too much diuretic effect can include dizziness, extreme thirst, dry mouth, weakness, confusion, muscle cramps, fainting, very low blood pressure, or urinating much less than usual. Warning signs of fluid overload can include swelling, shortness of breath, rapid weight gain, and difficulty lying flat. Diuretics can protect you, but if used without monitoring, they can also create kidney stress. Medication group number 4 is proton pump inhibitors, also called PPIs. These are acid-reducing medications. Common examples include omeprazole, esomeprazole, pantoprazole, lansoprazole, and similar drugs. People take them for heartburn, reflux, ulcers, gastritis, stomach protection, and acid-related discomfort, and they can work very well. If someone has severe acid reflux, ulcers, bleeding risk, or specific stomach conditions, PPIs can be very helpful, but here is where the problem begins. Many people start a PPI for heartburn and then never stop. 1 month becomes 6 months. 6 months becomes 3 years. 3 years becomes 10 years. Nobody reviews it. Nobody asks if it is still needed. Nobody checks magnesium. Nobody checks whether kidney function has changed. Nobody asks whether lifestyle changes could reduce the need. The medication simply becomes part of the morning routine. And that is where a helpful drug can become an unmonitored habit. Long-term PPI use has been associated in research with kidney concerns, such as acute interstitial nephritis, acute kidney injury, and chronic kidney disease risk. Now, let me be careful. Association does not mean every person who takes a PPI will develop kidney disease. Many people take PPIs safely when they are needed, but long-term use should be reviewed. One possible kidney-related problem is acute interstitial nephritis. This is inflammation in the kidney tissue, sometimes triggered by medications. It may not always cause obvious symptoms. Sometimes the first clue is abnormal kidney blood work. Another issue is low magnesium with long-term PPI use. Low magnesium can cause muscle cramps, weakness, tremors, abnormal heart rhythms, seizures in severe cases, and other problems. Electrolytes matter. Your heart and kidneys care about them. Now, the mistake is not taking a PPI when you truly need it. The mistake is taking it forever without review. If you take a PPI, ask your doctor these questions. Do I still need this medication? Can I use the lowest effective dose? Can I step down safely? Can I switch to a different approach? Should my kidney function be checked? Should my magnesium level be checked? Could weight loss, avoiding late meals, raising the head of the bed, reducing alcohol, stopping smoking, or avoiding trigger foods help my reflux? Do not stop suddenly if you have severe reflux, ulcers, Barrett's esophagus, bleeding risk, or a doctor specifically prescribed it for stomach protection. Stopping suddenly can cause rebound acid symptoms, but do ask for a plan. A medicine that helps heartburn should not be ignored for years without review. Medication group number 3 is ACE inhibitors and ARBs. This section is very important because these medications are often misunderstood. ACE inhibitors include medicines like lisinopril, enalapril, ramipril, and others. ARBs include losartan, valsartan, irbesartan, candesartan, and others. These medicines are commonly used for high blood pressure, heart failure, diabetes, protein in the urine, and chronic kidney disease. And here is the important part. ACE inhibitors and ARBs can protect the kidneys in many patients, especially people with protein in the urine, diabetes-related kidney disease, or high blood pressure. They can reduce pressure inside the kidney's filtering units and slow kidney damage over time. So why are they on this list? Because a kidney protective medicine can still require kidney monitoring. When you start an ACE inhibitor or ARB, creatinine may rise slightly. That can be expected. It may happen because the medicine changes pressure inside the tiny filtering units of the kidney. A small change does not automatically mean kidney damage. But if creatinine rises too much or potassium becomes too high, your doctor may need to adjust the dose, repeat labs, or investigate another issue. These medicines can become riskier if you are dehydrated, vomiting, having diarrhea, taking NSAIDs, taking diuretics, or have narrowing of the arteries that supply the kidneys. The dangerous mistake is stopping these medicines because you heard they affect the kidneys. For many people, they are prescribed specifically to protect the kidneys. Another dangerous mistake is taking them without monitoring. If you take an ACE inhibitor or ARB, ask your doctor how often to check creatinine, eGFR, and potassium. Ask what to do when you are sick and cannot keep fluids down. Ask whether NSAIDs should be avoided. Ask whether potassium supplements are safe. Ask whether salt substitutes are safe. This is important because many salt substitutes contain potassium chloride. And if you take ACE inhibitors, ARBs, or spironolactone, potassium may rise in some people. High potassium can be dangerous for the heart. Symptoms may include weakness, palpitations, chest discomfort, or feeling faint. But sometimes high potassium has no obvious symptoms. That is why lab testing matters, so remember this clearly. ACE inhibitors and ARBs are not bad kidney medications. For many people, they are kidney protective. But they need monitoring. They need caution during dehydration. They need caution with NSAIDs. And they need potassium awareness. Medication group number 2 is antiviral medications. Antivirals are used for viral infections. Influenza, herpes, HIV, hepatitis B, hepatitis C, COVID-19 in certain situations, and other serious viral illnesses. Some antivirals are used for a few days, some are used for months, some are used for years, some are life-saving, some reduce viral load, some prevent severe disease, some protect the immune system. So again, antivirals are not bad. But some antivirals need kidney attention. Certain antivirals can form crystals in the kidney tubules if hydration is poor. Some can affect kidney tubular cells directly. Some require dose adjustment when eGFR is reduced. Some require monitoring during treatment. Examples that may need kidney attention include acyclovir, tenofovir, foscarnet, cidofovir, and others depending on the situation. The risk depends on the drug, dose, hydration status, kidney function, age, and other medications. Now, here is the dangerous mistake. A person gets an antiviral prescription and does not take it consistently, or they buy medication online from an unofficial source, or they continue the same dose even though kidney function has changed, or they do not tell the doctor they have CKD. For chronic viral infections like HIV or hepatitis, skipping doses can lead to resistance or treatment failure. For kidney safety, dose adjustment may be important. So if your doctor prescribes an antiviral, ask these questions. Is this medicine cleared through the kidneys? Does the dose depend on my eGFR? Do I need kidney blood tests before or during treatment? How much fluid should I drink while taking it? What symptoms should make me call? Does it interact with my other medications? Can I take it with NSAIDs? Should I avoid supplements while taking it? Warning signs can include reduced urine output, swelling, severe fatigue, confusion, flank pain, nausea, vomiting, or feeling much worse during treatment. Antivirals can be extremely important. Use them correctly. Do not skip. Do not self-prescribe. Do not buy from unknown sources. And make sure your kidney function is part of the prescribing decision. Now we come to medication number 1, lithium. This one deserves special attention. Lithium is a mood stabilizer used for bipolar disorder and certain psychiatric conditions. For many people, lithium is life-changing. It can reduce manic episodes, it can stabilize mood, it can reduce relapse risk, it can help people regain control of their lives. So I want to say this clearly. Lithium is not a bad medication, but lithium is a medication that must be respected. Lithium has a narrow therapeutic range. That means the helpful level and the toxic level are closer than with many other medicines. Lithium is cleared by the kidneys. That means kidney function matters, hydration matters, salt intake matters, drug interactions matter, illness matters, vomiting matters, diarrhea matters, diuretics matter, NSAIDs matter, ACE inhibitors and ARBs matter. Over time, lithium can affect the kidney's ability to concentrate urine. This can cause a condition called nephrogenic diabetes insipidus. This is not blood sugar diabetes. It means the kidneys do not respond properly to the hormone that helps concentrate urine. The result can be excessive urination and extreme thirst. A person may wake up several times at night to urinate. They may drink large amounts of water. They may feel dehydrated easily. They may think it is just aging or habit, but it may be related to lithium. Long-term lithium use can also be associated with chronic kidney changes in some patients. That is why monitoring is not optional. If you take lithium, you need regular lithium blood levels. You need kidney function monitoring. You need thyroid monitoring. You may need calcium monitoring. You need to understand toxicity symptoms. Lithium toxicity can include tremor, diarrhea, vomiting, drowsiness, confusion, poor coordination, muscle weakness, slurred speech, severe fatigue, and in serious cases, seizures or dangerous complications. If you take lithium and develop vomiting, diarrhea, fever, dehydration, confusion, severe tremor, unusual weakness, or new coordination problems, seek medical advice quickly. Do not simply take the next dose and hope it passes. Do not change your dose on your own. Do not stop suddenly without medical supervision, because stopping lithium abruptly can destabilize mood. The safety loop for lithium is clear. Take it exactly as prescribed. Keep blood test appointments. Keep hydration and salt intake consistent unless your doctor tells you otherwise. Tell every doctor and pharmacist that you take lithium. Avoid adding NSAIDs, diuretics, ACE inhibitors, or ARBs without checking. Ask how often to check lithium levels, kidney function, thyroid function, and calcium. Carry a medication list. No toxicity symptoms. Lithium can protect the mind, but monitoring protects the kidneys. Now let us pause and connect the pattern. These 7 medication groups are not all dangerous in the same way. Antibiotics may need kidney-based dosing and can sometimes directly stress kidney cells. NSAIDs may reduce kidney blood flow, especially during dehydration or in high-risk people. Diuretics can cause dehydration or electrolyte imbalance if not monitored. PPIs may be linked with kidney inflammation or low magnesium during long-term use. ACE inhibitors and ARBs can protect kidneys but require creatinine and potassium monitoring. Antivirals may need dose adjustment and kidney monitoring. Lithium requires careful blood levels and kidney monitoring because the kidneys clear it. The theme is not fear, the theme is respect. Medicines are powerful because they change biology, and anything powerful deserves monitoring. Now let me tell you a bigger story. Imagine a man named Robert. Robert is 64 years old. He is a good man, he works hard, he helps his family, he does not think of himself as sick. He has high blood pressure, but he takes a pill for it. He has ankle swelling, so his doctor gave him a water pill. He has knee pain, so he takes ibuprofen from the pharmacy. He has heartburn, so he takes omeprazole every morning. He does not think of any of this as dangerous because every medicine is common. The blood pressure pill was prescribed. The water pill was prescribed. The heartburn pill is everywhere. The ibuprofen is sold without prescription. So in Robert's mind, everything is normal. Then one summer, Robert gets sick. A stomach virus. He has diarrhea. He eats less. He drinks less. He sweats because the weather is hot. But his knee still hurts, so he keeps taking ibuprofen. He keeps taking the water pill. He keeps taking the blood pressure pill. He keeps taking the heartburn pill. 2 days pass, then 3. He starts feeling weak. He urinates less. His mouth feels dry. His ankles look puffy. He feels short of breath walking to the bathroom. His wife says, "You do not look right." At the clinic, his blood tests show his kidneys are under stress. Robert is shocked. He says, "But doctor, I only took normal medications." And that is the lesson. Common does not always mean safe in every situation. The danger was not one pill alone. It was the combination: age, dehydration, diarrhea, diuretic, blood pressure medicine, NSAID, long-term heartburn medicine, no medication review, no sick day plan, no kidney monitoring. Now imagine if Robert had asked one question earlier. What should I do with my medicines if I become dehydrated, vomit, or have diarrhea? That one question could have changed the story. This is why medication education matters. Not because you should fear every pill, because you should understand the situation around the pill. Now here are kidney warning signs you should never ignore, especially after starting a new medication or combining medications. Urinating much less than usual. Swelling in the ankles, legs, hands, or face. Sudden weight gain. Shortness of breath. Foamy urine that keeps coming back. Blood in the urine. Severe fatigue, confusion, nausea or vomiting. Muscle cramps. Severe weakness, very high blood pressure, dizziness or fainting, back or side pain with fever, extreme thirst and urinating constantly, new tremor or coordination problems if you take lithium. These signs do not always mean kidney failure, but they deserve attention. Do not self-diagnose. Do not panic, but do not ignore them. Now here are the exact questions to ask before taking any new medication. Is this medicine safe for my kidneys? Do I need kidney function testing before starting it? Does the dose depend on my eGFR? Could this affect potassium, sodium, magnesium, or other electrolytes? Should I avoid NSAIDs while taking this? Does this interact with my water pill, blood pressure medicine, lithium, antibiotics, antivirals, or supplements? What symptoms should make me call you? What should I do if I become dehydrated, vomit, have diarrhea, or cannot eat and drink normally? How long should I take this medication? Do I still need it after symptoms improve? Should this medicine be reviewed in 3 months, 6 months, or 1 year? These questions are not complicated, but they are powerful. Because most medication mistakes happen when nobody connects the full picture. One doctor prescribes one pill. Another doctor prescribes another. The patient buys something over the counter. A supplement is added. Then dehydration happens. Then kidney function changes. And nobody realizes the combination until symptoms appear. That is why you need a complete medication list. Write down every prescription, every over-the-counter medicine, every painkiller, every heartburn pill, every antibiotic, every supplement, every herbal product, every vitamin, every protein powder, every detox tea, everything. Bring that list to every doctor visit. Show it to your pharmacist. Keep it on your phone. Keep a copy in your wallet. If you go to the hospital, show it. If you see a new specialist, show it. If you go to urgent care, show it. Because your kidneys do not care whether the pill came from a doctor, a pharmacy shelf, a supplement store, or the internet. They still have to deal with it. Now let us build a 30-day kidney-safe medication plan. For the first week, do not change anything on your own. Just observe. Write down every medication and supplement you take. Include dose. Include how often. Include why you take it. Include who prescribed it. Include over-the-counter medicines. Include painkillers. Include heartburn pills. Include sleep aids. Include vitamins. Include herbs. Do not judge yourself. Just make the list. For the second week, look for hidden risks. Are you taking NSAIDs often? Are you on a diuretic? Are you on an ACE inhibitor or ARB? Are you taking a PPI every day for years? Are you taking lithium? Are you using supplements your doctor does not know about? Are you saving old antibiotics? Are you buying medicine online? Mark anything that needs a conversation. For the third week, schedule a medication review. This can be with your doctor or pharmacist. Ask, do I still need all of these? Ask, are any of these risky for my kidneys? Ask, do any interact? Ask, do I need kidney blood tests? Ask, do I need electrolyte tests? Ask, what should I do during dehydration or illness? For the fourth week, create your safety plan. Know your eGFR. Know your creatinine. Know whether you have protein or albumin in the urine if you are at risk. Know your potassium if you take ACE inhibitors, ARBs, spironolactone, or have kidney disease. Know your magnesium if you take long-term PPIs and your doctor agrees. Know your lithium level schedule if you take lithium. Know which pain medicine is safest for you. Know when to call. Know when to seek urgent care. That is how you stop guessing. Now, who is at higher risk for medication-related kidney problems? People over 60. People with chronic kidney disease. People with diabetes. People with high blood pressure. People with heart failure. People with liver disease. People who take multiple medications, people who use NSAIDs often, people who become dehydrated easily, people on diuretics, people on ACE inhibitors or ARBs, people taking lithium, people with a history of acute kidney injury, people who use supplements without medical guidance. If you are in one of these groups, do not be afraid. Be organized. Fear makes people stop medicine incorrectly. Organization helps people use medicine safely. Now, let us summarize the 7 medications again. Antibiotics. Use them only when needed, take them correctly, never share or save them, and ask if the dose fits your kidney function. NSAIDs. Be careful with ibuprofen, naproxen, diclofenac, and similar drugs, especially if you are older, dehydrated, have CKD, or take diuretics or blood pressure medicines. Diuretics. They can help swelling and blood pressure, but they can also cause dehydration or electrolyte problems if not monitored. PPIs. They can help reflux and ulcers, but long-term use should be reviewed and monitored. ACE inhibitors and ARBs. They can protect kidneys in many people, but creatinine and potassium should be monitored, especially during illness or medication changes. Antivirals. They can be life-saving, but some require kidney-based dosing and careful hydration or monitoring. Lithium. It can stabilize mood, but requires regular blood levels, kidney monitoring, thyroid monitoring, hydration awareness, and interaction caution. Now here is the final truth. A medicine can help you. A medicine can harm you. And sometimes the difference is not the medicine itself. It is the dose, the timing, the hydration status, the kidney function, the age of the patient, the other medications, the monitoring, the communication, the follow-up. That is why the smartest patient is not the patient who refuses medicine. The smartest patient is the one who asks better questions. The one who says, here is my full medication list. The one who says, is this safe for my kidneys? The one who says, do I need blood work? The one who says, what should I do if I get sick and dehydrated? The one who says, do I still need this medication? That patient protects their kidneys. So if you take any of these 7 medication groups, do not panic. Review, ask, monitor, use correctly, and never stop important medication without medical guidance. If this video helped you, share it with someone over 50 who takes painkillers, heartburn medicine, antibiotics, blood pressure pills, water pills, antivirals, or lithium. They may not need fear. They may need one clear conversation with their doctor or pharmacist. This video is for educational and informational purposes only. It is not personal medical advice and does not replace your doctor, pharmacist, nephrologist, psychiatrist, cardiologist, infectious disease specialist, or healthcare team. Do not stop, start, skip, or change any medication without speaking to a qualified healthcare professional. Seek urgent care if you have severe symptoms such as confusion, severe weakness, trouble breathing, chest pain, severe allergic reaction, very low urine output, blood in urine, severe dehydration, signs of lithium toxicity, or signs of serious infection. I am Dr. Adrian. Take care of your kidneys. Take care of your medications. And remember this, your kidneys do not need you to fear medicine. They need you to respect medicine. The pill matters, the dose matters, the combination matters, the monitoring matters, and the conversation with your doctor matters. Protect your kidneys before they have to shout.